This conference will now be recorded.
And Chapel peoples who were forcibly removed after signing the Willamette Treaty and are still with us, the Confederated Tribes of the Grand Ronde and Confederated Tribes of the Celeste. And we work to honor their commitment to sustaining our natural environment, which keeps us all going. So from there, I also want to acknowledge that all of us are under stress these days, from Delta variant, from people who are experiencing mental health distress and getting into trouble with our justice system and on the streets, to being burnt out from working so hard. So patience and tolerance for everyone would be really welcome, given the fact that everyone's trying to do a lot all at once. So, moving on, I would like to move into our standard introductions. I'm Dan Ogerow, the Board Chair of Benton County.
Nancy Wyatt, Commissioner and Vice Chair.
Pat Malone, Commissioner.
Joe Kirby, County Administrator.
Eric Milo, Board Recorder.
Greg Riddler and Sheriff Van Arsdale, Sheriff's Office.
Alyssa Rash, Public Information Officer.
Sylvia Neville, Board of Commissioners Staff. Teresa Farley, Board of Commissioners Staff.
Brian, the Emergency Manager.
Suzanne Hoffman, Health Department Director. April Holland, Public Health Administrator.
You're muted, Bruce. Good morning.
Good morning, everyone. Sorry, Bruce Thompson, Benton County Health Officer.
Okay.
I'm the CEO of Good Samaritan Regional Medical Center. Good morning.
Good morning. Welcome. I see we have a couple of others. We have Gordon Kurtz from Public Works, Chris Bailey, Neil Webb, and I'm not sure who. Well, I know that we have a telephone connection in the board office, but is caller free someone Joe? Oh, no. Okay. Let's get going. Are there any other announcements for STEM this morning? Are there any comments from the public? Okay, our next agenda item is to review and approve the agenda. We do have an executive session that we'll be adding to the end of this meeting under ORS 192.660D for bargaining. We anticipate that session will probably take 45 minutes or so, could be a little bit longer. So we will take breaks accordingly as we move through this morning's business. And we will clear the room of all except those folks that need to be in that executive session after we finish all of our other business before we step into the executive session. So I don't have any other changes to the agenda. Commissioner White, Commissioner Malone, any notes? Okay. We will then consider the agenda approved and move on to item 4, our work session. And we'll begin with the report from our Departmental Operations Center, Suzanne Hoffman and April Holland, and we have special guest Laura Hannah with us today to update us on the status of the Samaritan Hospital system as well.
Good morning, Commissioner. Thank you. Indeed, we have, as you pointed out, a lot going on right now, and so April will be providing a standard update, but really focusing in on some proposed public health actions we recommend to be taken in our community. Very pleased to have Laura Henham join us. As she said in her introduction, she's the CEO of the Samaritan Regional Medical Center. She has been, she and her team have been incredible partners, as you also know, in our COVID prevention, mitigation, response efforts, especially around the mass vaccination clinics that we could not have done without our partnership between the county and Samaritan and Oregon State University. And after speaking with Laura, I think it was about a week ago, and so much has moved so rapidly even since then, that was apparent that there were concerns growing not only for particular hospitals outside of our region, but hospital systems across the state. And Laura is the best person to speak to us about not only what's happening in Corvallis and our region, but really how the system is being affected around the state. And perhaps we can have some conversation before this full update is over about some of the assistance that the state is bringing to bear on that and what, if any, role the county could be playing as a good partner in that effort as well. I believe we're going to begin with Laura and then move to April, and also want to thank Dr. Bruce Thompson for joining us today as our health officer, and he may weigh in along the way as well. Turn over to you, Laura. Thank you.
Thank you, Suzanne. And I certainly want to echo what Suzanne shared in terms of the partnership between Benton County Public Health, Oregon State University, and Samaritan. We have continued to be extremely grateful for the strength and level of commitment within that partnership, and certainly want to do everything we can to continue to support Benton County Public Health. Benton County, as many of you know, was an early mover in community vaccination efforts, really moving very quickly to the top of the list in terms of not only for an extended period of time as the most vaccinated county in the state, but I know continues to be one of the most vaccinated communities in the state. Unfortunately, that doesn't shield us from the impacts of COVID, and again, Suzanne is exactly right. With the Delta variant, it is moving quickly and intensely at this point. According to the current modeling available from OHSU, the modeling indicates that we will not peak with this current surge until the first week in September. So unfortunately, it appears that we're really at the beginning rather than the end in terms of this latest surge. We are feeling it most acutely at Good Sam, as are other hospitals, not only throughout Oregon, but certainly throughout the country. And I know we're all reading and hearing the same stories. What I want to share specifically with you is talk a little bit about the state and then move to what we're seeing in our community. So over the past week, and that would be the period from August 2nd until August 8th, there has been a 40% increase in COVID-19 cases in the state. This is the 5th consecutive week of case growth. So unfortunately, we are not seeing any downward trend, any emerging trends in terms of this going down. Unfortunately, it just continues to trend up in a material way. There were 40 deaths during that week in the state. That was up from 25 the previous week. There were 322 new cases, up from 256 for the prior week. And statewide, we're currently at a 9.5% positive test rate, and that's compared to a goal of 4%. And at a 9.5% positivity rate, that indicates an out-of-control spread, unfortunately, within the state, as well as insufficient testing. Oregon right now is one of the hardest hit states, behind many of the southern states. And there are a number of hypotheses as to why that is. The one that resonates the most for me is the fact that Oregon has done an outstanding job in years past in becoming much more efficient in optimizing what we provide on an outpatient basis. Unfortunately, a consequence, an unintended consequence of that is that we are the lowest. We are the last in the United States in terms of the number of the number of inpatient beds per 1,000 population. Right now, Oregon is at 1.7 beds per 1,000 population. You compare that to the number one state currently in the country, and these are based on April 2021 numbers and rankings. You compare that to South Dakota that has 4.8 beds per 1,000 population. So you can see how it can become quickly challenging. There was an individual at the state level who was sharing this update with us at the hospital, and he said that unfortunately our number of inpatient beds within the state provides a quicker path to crisis. And while I am pathologically optimistic, there are times where we have to be realistic about the challenges before us, and that is most certainly a challenge before us at this point. Right now, the Delta variant is indicating that it burns through quickly, and already, just as Suzanne said, last week we were seeing something very different than we are this week. Yesterday, from my perspective, was a turning point and a significant one. We were at 21 positive admitted COVID cases yesterday. That, unfortunately, was the new record. As of this morning, we are at 25 admitted COVID-19 cases at Good Sam. Throughout the Samaritan system, we have 39 admitted COVID cases. So you can see Good Sam, unfortunately, makes up the lion's share. Statewide, 95% of admitted COVID-19 cases are due to the Delta variant. I will also share with you that we track what we call breakthrough hospitalizations, and currently, and what that points to is those individuals who are fully vaccinated as compared to unvaccinated. Currently, 9.9% of our admitted COVID-19 cases are fully vaccinated. So therefore, 90%, 90.1% to be exact, are unvaccinated. System-wide, that number jumps up a bit in terms of those who are unvaccinated. We're at 94% across our system. 94% of patients who are unvaccinated are admitted COVID-19 patients. So at the same time we're dealing with the surge on the hospitalized side, what we didn't see at the beginning of the pandemic was the impact to our emergency room. That is very different now. Within our emergency room at Good Sam, we are not only to pre-pandemic levels, we're now significantly higher. We are consistently, over the past week, we are now consistently at above 100% utilization. Actually, yesterday afternoon, we were 119% of capacity for our emergency room. So we are seeing a much higher number of COVID-19 patients who come to our emergency room, along with those individuals who do not have COVID-19. So many experts talk about pent-up healthcare demand. I think it's also really important to share with the Board of Commissioners that and something that I think is very important to reinforce is oftentimes we hear about hospitals are canceling elective cases in order to free up beds. I actually do not like to refer to any surgical case as elective. They are scheduled. Because unfortunately, when we say something's elective, it makes it sound like someone can choose to have a surgical procedure or not. When we have to delay or cancel a scheduled procedure that impacts heart surgery patients, it impacts cancer patients, it impacts significant orthopedic cases. So one of the things that we do at Good Sam is we are now meeting every morning and every afternoon to evaluate our scheduled procedures. You've probably seen in the news there are a number of hospitals. I know St. Charles Medical Center in Benton, for example, has indicated that they will not be scheduling any scheduled cases until the end of the year. We are taking a slightly different approach in that we are evaluating twice daily and trying to be as selective as we can be to either delay or cancel, reschedule, deschedule cases depending on the severity of the ailment or chronic issue that is being taken care of or attended to by that scheduled surgical procedure. So we're trying to be as selective as we can. At some point, we may have to change that approach if we continue to see this level of impact. We are now up to 3 dedicated COVID-19 units in our hospital, and that's a significant change. We had been operating at 1 dedicated COVID-19 unit. We now have 3. We've identified the possibility of a 4th. If we need to move to a 4th dedicated COVID-19 unit, we will have to take a much more aggressive look at our scheduled procedures. We prefer not to do that, of course, because of all the reasons I just named, but also back to the pent-up health demands. We used to think that people couldn't stop healthcare issues from happening, but unfortunately, individuals can ignore issues. They can put off issues. And that just feeds, unfortunately, a really vicious circle of, wait, now they really do need to attend to an issue, and they pop up in the emergency room. So another component of this, as I said, and something that is new from the first stage of the pandemic, are the impacts to our emergency room. So right now, as part of our surge plan, we are evaluating whether we may have to, and this is where staffing becomes a distinct variable, we are evaluating whether we need to create temporary space for our emergency room. We will make a go, no-go decision by the end of this week as to whether we will create additional temporary space so that we can triage acuity versus lower acuity. So it really depends on how we continue to surge with these cases. And as I said, we woke up Friday morning, Good Sam had 11 COVID-19 admitted cases, and as I said, now fast forward to this morning at 25. So you can see how quickly it is moving. The staffing piece, again, not telling anyone anything that you haven't heard already, we are dealing with significant impacts across all job types. Certainly we feel it most acutely with our nurses, with certified nurse assistants, but it really touches every corner of the organization. Housekeepers, techs, even case managers, and all of those things are very important. Right now, 3 of the 5 skilled nursing facilities that we typically discharge patients to are under executive orders and can no longer accept our patients. So that's the other piece that we have to continue to manage through. Is historically where we've been able to discharge less acutely ill patients, we are unable to do so at this time. So that's one of the things that we're working closely with the State Hospital Association on. Is there anything that can be done at the state level? I know the governor is expected to make some additional announcements later this week about additional resources that are being brought to bear for hospitals. One of those is the possibility for additional flexibility with state regulation, state policy. We're hopeful we may get some relief with those discharges. I also know that the governor has indicated that there are 1,500 members of the National Guard. 500 of those have already been deployed to Central and Southern Oregon. We have not made a formal request at this point for National Guard support. We want to be respectful of those areas that have been most hard hit, but of course we will continue to track on what our needs are. The Hospital Association indicated to us that we should make it clear what our needs are, and that doesn't necessarily constitute a formal request of the governor or of National Guard resources. So we will monitor that on a day-by-day basis. And then I would say lastly, and this probably is a good segue back to Suzanne and April, is that we are fully supportive, of course, of the statewide, and I know Benton County, again, early adopter, really appreciate that, statewide and countywide mask mandates. I certainly, as a key member of the Good Sam team, I certainly want to emphasize how important it is, anything that we can do to mitigate the spread. The state has shared with us that the Delta variant has what they refer to as an R value of 8. Typically, variants prior to this have had an R value of 4. And what an R value of 8 means is that for every 1 infected person, they will infect 8. And so this variant has, of course, become, it has completely overtaken other variants. And so for us, because of the level of contagiousness associated with the Delta variant, we certainly want to step up and articulate that anything, any individual, community body, community leadership can do to help reduce that spread. We support it, we encourage it. We have not, as you might imagine, we have not changed our universal masking precautions, our universal masking policy throughout the entire pandemic. That continues to be of utmost importance for us. We are assessing our visitor policy at this point, so there may be some changes, but there will be no changes, of course, to our masking mandate and also our precautions that we're taking, not only to keep each other safe, but of course to keep our patients and community safe. So I will turn it back to Suzanne and April, and of course happy to take any comments or questions.
Thank you, Laura.
Great, thank you. April, this is right to you.
Thank you so much. Thank you so much for being here, Laura, and for giving us an update on what is happening statewide. And at Good Sam, our hearts are with you, and we're thinking about you and all of the healthcare workers and others in response to what's happening right now. If I could be made the presenter, I can pull up a brief update before we get into some public health recommendations.
Sure, just one moment.
Thanks. Okay, are you able to see the slideshow? Yeah. Great. Thank you. Okay, I'm just going to jump right in here. I had a great introduction by Laura, so just going to show you what our weekly cases have looked like. We've had a 29% increase this past week from the previous week. You can see the increase from that trough around when the mask mandate was lifted, and unfortunately Delta also started to come through. Big increase from the end of June. Going into a little bit of detail, I don't have a new ribbon graph to share with you, but I do have a breakdown of some cases. This information includes cases from July 1st to August 12th, so not quite up to date, but gives us a good snapshot of what's going on. Youth under 12 are about 9.7% of our population, roughly. So, they are being infected. They're not currently overrepresented at the 8.9% of our cases are currently under age 12. However, of those 35 cases, 30 of them were attending congregate settings. So again, a reminder of just how transmissible Delta variant is when people get together. Right now, I also want to share that we're monitoring 18 school and healthcare locations with current cases. At any given time, when we had more moderate case rates, we would have a couple. And now, because we are in our surge protocols, we are prioritizing these settings. So 18 currently that we are keeping track of. So we talked about breakthrough cases, and those as Laura mentioned, and as we've talked about before, those are fully vaccinated people who have a report of an infection. It takes time for some records to be reconciled, case interviews to occur, et cetera, to determine how many of our cases were fully vaccinated. I came to you near the end of July and shared, more than 20% of cases were fully vaccinated. And we got some more, our data improved and the figure raised to 28%. And our data now show that 76 of the 220 cases reported in July were fully vaccinated in Benton County, so that's 35% of all cases. If you look at unvaccinated case rate versus the vaccinated case rate, it really helps to illustrate the benefit of the vaccines overall for infections, period, reported infections, period. And then looking at the hospitalization data that Laura shared, you can see further the benefit to vaccination, which is more important now than ever. So our case rate for fully vaccinated people was 127 per 100,000 of vaccinated people, and it was 413 per 100,000 of people not fully vaccinated. So the rate of reported infections for unvaccinated was 3.25 times greater than that of vaccinated people. If you haven't seen yet, we have various ways of looking at community transmission. OHA established a new community transmission metrics dashboard to more closely align with what CDC uses, which is a 7-day case rate. We're used to a 14-day case rate here with the old risk and protection framework from OHA. You can see here the thresholds for low, moderate, substantial, and high. And these align really closely with CDC. So right now, 32 out of 36 counties in Oregon are classified as having high transmission. I just want to show you a side-by-side of the case rate so you can kind of visualize what it looks like. The 14-day rate just kind of smooths things out a little bit, so you can account for little blips and disruptions. It kind of smooths the line out a little bit, where the 7-day gives you a really distinct look at that weekly case rate. Either way, we had 200, which was extreme before with the 14-day rate, and 100 now for high. I won't spend too much time talking about hospitalization since it was already covered. This is a really scary illustration. When every couple of days the y-axis has to be increased upward, it's definitely not good. Latest data shows 752 hospitalized in the state, 206 in ICU, and 112 on ventilator support. Laura went over a lot of this. Thankfully, we have state actions in place to help support the hospital system. Last week, the OHA activated an incident management team to deal with discharge issues, staffing challenges, strengthen the capacity of the system overall. And then there you can see some of the detailed items that the state is working on currently. Generally, I want to just reiterate some of these key points about Delta that I know you've heard from me in great detail many times, but just as a review, Delta is very transmissible. There's evidence out there that shows that it may result in more severe outcomes for people. Obviously, the people who are not vaccinated are most vulnerable, as well as those who have compromised immune systems. We know that vaccinated people can be infected and that some can transmit the virus. Vaccine effectiveness is lower in certain groups. And we know, as I keep saying, the best time to, vaccination is more important than it ever has. These vaccines continue to protect very well against severe disease and death. And before I move on into some recommendations, I would like to pause to hear from Dr. Thompson, our local health officer. Dr. Thompson is our clinical leader in public health, and we're so appreciative to consider his observations, insights, and his recommendations. Dr. Thompson?
Thank you, April. Yes. Once again, thank you for permitting me to be here to share my reflections. There's a lot of sad news in the pandemic. One of the best things I tell people all the time out of the pandemic is the partnerships that we form within our community and the way we work together to solve problems. Benton County has been in a leadership role, not only in this pandemic, as Laura has pointed out, but let's not forget that Benton County in 1918 was the first community in the nation to ban public meetings. And more recently, it was the second community in the nation to ban smoking in bars and restaurants. So we have a lot of great things to be thankful for being in this community, and I am thankful for being a health officer in this community. Just to underscore a couple of the items regarding hospitalization. So in Region 2, as of this morning, there are 5 ICU beds left available, 5 beds left available in our entire Region 2. In Regions 5, 6, and 7, each of them have 1 bed left available in their ICUs. And furthermore, to really highlight the nature of the problem has to deal with how transmissible this variant of the virus is that we are dealing with. This is not the same virus that we were dealing with for the past year. This is clearly a different virus. And everything we've learned over the past year helps us because we knew nothing when the first variant attacked us. We know a little bit more now with this variant. However, we cannot apply the same rules from the previous experience to this experience. So one of the areas where I would like to focus on for moving forward is regarding masking, because clearly this is helpful. This is one of the lessons that we have learned over the last year. And as part of that, Governor Brown has put into place the masking mandate for indoor sites, including schools. However, the outdoor sites are kind of left behind, and I think this is an area that for our community it would be beneficial to move forward to have masking in crowded outdoor venues, particularly at concerts or at sporting events. Laura referred to the R value of 8, so one person infects 8. So the old standard rule of, if you're in contact with a case for 15 minutes within 6 feet, then you likely have been infected. that changes when you have an R value of 8. So in crowded outdoor spaces where, given the case rate that we have in the community, where you have more people who are infected with a virus that is more infectious, the old rule of 6 feet for 15 minutes, the equation has not been calculated, but it's clearly different. So just as Benton County has led in the past with public health measures, I would recommend that moving forward, Benton County recommends and at least recommends that masks be worn in crowded outdoor spaces. I have a further concern to express here today, which I just became aware of in the past week through an email that was forwarded to me. And my concern is around schools who do not adhere to Governor Brown's mandate for wearing face masks in indoor spaces, including schools. So we've all seen stories about states where masks not being worn in school was not a mandate, and schools having to shut down after 2 weeks of being open. So we want our schools to be open, and I firmly believe that the majority of our schools will be adhering to Governor Brown's mandate. However, in this email that was forwarded to me, a school superintendent had emailed parents as well as Oregon state legislators, reminding parents that by filling out a 504 plan, their child would be exempt from wearing a mask at school. This is most appropriate, and certainly there's a reason for having a 504 plan for the very small number of children who will need to have verification of a physical or mental condition in order to fulfill a 504 plan. However, I just don't understand why this email would have been sent to Oregon state legislators, and I suspect that there may be other schools throughout our state that are echoing this reminder to people that they could simply fill out a 504 plan and not have to wear masks. So this kind of strategy will not help control the spread of Delta, and we hope that there will be some kind of response or pushback to any movement in the direction of going around Governor Brown's mandates for wearing masks in schools. Again, sorry for the bad news here, and I thank you for being partners throughout this pandemic and achieving the successes that we have been able to achieve so far. I'll be happy to answer any questions as time permits. Thank you.
I have a question for Dr. Thompson. The school that you are referring to, was that in Benton County?
It was in Benton County.
Okay, thank you.
Dr. Thompson, thank you so much for your comments and for your recommendations. We appreciate your leadership so much. I hope that you'll be able to stick around for questions. I'm just going to move forward with this presentation, and then hopefully we can have a conversation about all of this. Just a brief recap. We can see, you know, the recent recommendations for universal masking, just to, again, reiterate how quickly all this has happened, some requirements for masking in certain settings, and then, of course, last Friday, the statewide masking, which became effective on Friday. Again, indoor spaces only, ages 5 and up, universal masking, and there's an exception to the rule for eating and drinking. Again, so our cases are increasing, our state, regional, local hospitalizations are off the charts, and our vaccination levels are not high enough to thwart transmission. Getting into outdoor settings, they are not included in the state requirement. Inclusion of a masking requirement in crowds would further decrease transmission. We've seen almost 70 cases associated at that last count. That was with the Pendleton Whiskey Fest, others with the Oregon Jamboree and various county fairs. I suggest and we suggest in the health department that we mirror the state order and that we should include masking at crowded outdoor gatherings such as fairs, festivals, farmers markets, and sporting events. Anytime distancing cannot be maintained. Many outdoor venues have people sitting or standing elbow to elbow, and that's not going to go over well with Delta variant in the picture. So I want to talk just for a minute about whether or not the board would like to consider a threshold, the number of people in a gathering. Our wonderful epidemiologist was able to estimate the number of new infections 4 weeks after a gathering of unmasked people with different percentages of vaccination in a group. Various things were taken into account. The risk reduction for being outdoors, the average number of contacts, assumed 80% effectiveness for vaccines, just to keep it level. The numbers that came back ranged from 59 new infections for a gathering of 25 people with all of them vaccinated to over 2,700 infections. This is infections, not reported cases, for a gathering of 300 people with 30% vaccination. So if you want to consider this and you want to include a threshold for the number of people at events, it's based on the group's risk tolerance, i.e. how many cases you'd be willing to risk given different sizes of gatherings that don't require masks. It's also important to consider the likelihood of compliance with smaller group sizes with an order that relies upon the people for adherence. As we know, there's no enforcement component in a local order. So I'd be happy to answer more questions about this. However, the gathering of 100, as it states here, with a 70% vaccination rate after 4 weeks is estimated to yield 522 infections. If you look at 300 with a 70% fully vaccinated rate, that could yield over 1,500 infections. You know, there are a few local orders out there, not in Oregon, that do require masking in crowded outdoor settings. None of them that I've seen do have a specific threshold. However, if you do want to state a threshold due to just ease of communication and that compliance piece, I suggest looking at one of these thresholds, 100, 200, or 300, because when we get down to the 10 or 25 people, there are going to be cases that result in that. It's never going to be zero, but you know, it just needs to be considered what that number should be. I think, 100 or more, 200 or more, or 300 or more are all acceptable thresholds.
April, Joe Kirby here. I would just like to interject real quick that when the board gets down to the agenda item later in today's agenda, I think it's agenda item 8.2, the face mask requirement that the board currently is considering today as it relates to outdoor numbers. We do have a placeholder in there of 300 or greater. So I just want to highlight for the board that this conversation will be coming back to you again under 8.2, but currently we have a placeholder of 300 in the proposed action for you today, and the board can change that, as April was alluding to, once we get to that agenda item if you're so inclined.
Yeah, so at this point in time, it's an opportunity for discussion and to ask questions because we have the experts here with us. Those numbers are really sobering, and I'm assuming much of that is because of the R naught, the fact that each infected person can infect another 8 people in 4 weeks, that amounts to many, many potential infections. It's difficult to make that call. I'm inclined not to go as low as 100, but either 200 or 300 feel comfortable. We can either debate that now or come back around to it when we get to item 8.2. But questions to our experts from Commissioners Wise and Long?
It seems like we've lost control of this, and it's more the message, trying to break through a lot of disinformation, and what we've had this morning. Okay, we've got great information. How best do we use it? And I would, at some point today, like to hear from our information folks what they think is the best, most effective message that we can do, and maybe at the top of the list is. It seems like we have a consistent theme of what we need to do is masking and vaccinations, and we're at this point kind of going upstream and having a tough time. I think I heard something this morning about, Oregon had 3,000 vaccinations yesterday or recently for a day, and earlier this spring it was 45,000. So it's not real clear to me what the magic number is. I think I'm fine with probably 200 or 300 in our resolution that we'll take up later, but that seems like along with that is why are we doing this, and what good can we do? But we're just, and like Dr. Thompson was talking about, school starts in a couple of weeks, and the nice summertime lull is, it didn't last very long, and it's about between the weather and school, have more chance to infect each other. So I guess that's what I have at this point.
Thank you, Commissioner, and I'd love to hear from Lilia. I just want to explain that with a threshold number, it's definitely not, there's no magic to it, unfortunately. But what we can do is say, at gatherings at this size, people must mask if they can't distance. Our other communications piece will be, right now, everyone, regardless of vaccination status, needs to put on that mask, avoid crowded spaces, distance when you can, get fully vaccinated. We all need to be doing all of it. That's the strong recommendation, but adding on that leadership component, but if it's going to be this big, everyone has to wear a mask, is where we can make a difference with some of those potential explosions in cases. Do you have, can you add something, Lily? You always state these things so well.
Apologies, I hit the wrong button. Certainly, yeah, so Commissioner Mullen, I think that's a really challenging question. I think it's a great question, and I think it's a really challenging question. For me, the message is really going to be dependent on the direction that the board sets. And, you know, I think that there are some timeless messages throughout this entire thing that we need to continue to rely on, which is what April has, you know, said already, that we need to practice all of the prevention measures, being fully vaccinated, staying, you know, separate, physically distancing from folks, washing your hands, covering your cough, not coming to work when you're sick, those types of things. So I do think that there is work that we can do to continue to underscore those messages. I think that we have an opportunity to share with our community that, you know, it's pretty bad out there. I'll be honest, I'm struggling right now because I'm a bit speechless with the numbers and the presentation of data when we look at the hospitalizations. I think it was Dr. Thompson who maybe said that there was 5 beds left in our entire region. So, you know, for me, candidly, it's even hard for me to see that we would have gatherings of 100 people, you know. So I am more than willing to, of course, message whatever direction the board wants to go.
I'm glad you mentioned hospitalization, because I'm not sure the general public has any clue what the situation is. I mean, there's a small percent that deal with hospitals, work in hospitals, and they know, but just that Southern Oregon is sending patients our way or further north, and because they're full, you know, you start talking about the National Guard being involved in hospitals, and that seems like National Guard is involved in disasters, floods, and we now have them involved in hospitals because we're on the edge of the system not working, and so I think that's got to be part of the message, and hopefully the plus side to school starting is people are back from vacations and maybe paying a little more attention to what the current situation is. And, but I agree with you, Lilia. It's a tough message.
Yes, it is. And, you know, we have had success with messaging around stress on the hospital system. For example, early last fall, we did a lot of messaging around a twindemic and trying to prevent the stress of endemic on our hospital system. So yes, Commissioner, I agree. I think that there is opportunity for messaging around that topic.
So,
Yeah.
Claire?
Sorry, go ahead. Oh, okay, so I'll go. Commissioner Malone, you are absolutely correct. I agree with you 100%. The general public is not aware of what is actually going on. And any messaging that we can get out there, the people in the hospitals are younger people. There's I'm not sure Laura could confirm, there's adolescents in ICUs in other places throughout the nation. I have not seen hospitalizations by age on the OHA websites that they maintain and update. But any way that we can get this message clearly out to the general public will help with people respecting whatever recommendations the Board of Commissioners put out there. So please, a press release, and it's not just about, the hospital situation is way worse than it was in December. Clearly. And it's not, it has already exceeded the peak in December and January, and it is heading in an upward direction. We have no idea, really. It's nice to see places where Delta does burn out in 2 months, but there's no guarantee that it's going to burn out here in 2 months. So, anyway, I'll stop.
Okay, thank you for that, Dr. Thompson. I'd like to give Nancy a chance to ask her question, and we also would like to learn a little bit more from April and Laura about alternative care sites and what that planning and discussion is looking like while Brian Lee is still on the phone. So I'd like to give us another 15-20 minutes on this topic, knowing we're going to circle back under 8.2. Nancy.
Thank you, Dan. So just to clarify, we are talking about the threshold of a crowd when masks need to be worn, not about capping the size of a crowd. Okay. Okay, so in that case, I'm looking at this. April, you said something that really resonated with me. What is the tolerance? What is my tolerance for allowing cases to spread? A gathering of 100 people, 522 cases. That's, do I want that on my conscience when I could have said, no, wear a mask? The answer is no. And I think I'd be more conservative and say, a crowd of 50, I'd be okay saying, please wear a mask. So it's my 2 cents.
Thank you, Commissioner Wise. And in the interest of time, I will move ahead. I look forward to talking more about this in a bit. I just want to mention that these are the number of infections. Not all of those would be reported. So, just to keep that in mind. We spoke about this previously with the board. The enforcement piece has never been a strong component in earlier mask mandates. What a mask requirement does is encourage social norms. We know that most people want to do the right thing and will follow rules as they are posted. Since we will have the state mandate in place for an unknown period of time for indoor spaces, we could refer those complaints to that process. And then for outdoors, if we do receive complaints, we can have a very general process where we can send a letter and have a strong outreach and education component, but will not have a true enforcement piece. Finally, just want to talk about if you had the county has its own indoor masking requirement and it adds the outdoor crowded spaces. In terms of ending, winter is coming, school is starting. We're right at some point of a surge. I suggest frequent evaluation of all of the metrics. We should look at hospitalization, we should look at our case rates, we should look at our vaccination rates, because that is what's going to really slow down the spread. We're not going to be likely to see a long-term dissipation of COVID spread without herd immunity, and our best guess right now for that is somewhere around 85%. It's a job of public health to prevent disease. We've been in response mode and reaction mode because we're in a pandemic, but taking that preventive measure and not taking off a mask right when we hit a threshold that feels okay is probably a good idea moving forward. So that's my public health suggestion on that piece. We need something to change. We've got the indoor public spaces. This requirement does have exemptions for eating and drinking. It's not going to be perfect, but it is going to have minimal economic impact. I think, based on what we see, nothing should be off the table in terms of potentially moving to something more restrictive if it comes to that. But this is going to help relieve some pressure. And then lastly, including that outdoor crowded spaces component will help prevent spread. Finally, there's your reminder every time. Have to let everybody know that implementing all the measures that we have at our disposal that we know will work are very, very important right now. And I will stop it there. Thank you so much for your time, and I'm happy to answer any questions.
This is more for our information folks, but it would be nice that several events have been mentioned, Benton, whiskey, something, and get how many known cases came out of that event, and the jamboree, and so it's not so theoretical that if you go to a large event, you might get sick. We have some examples, and I think those ought to be part of the message with this, realizing it's impossible to know all the cases, but at least these are the known, and if you can estimate how many more are out there, that could be part of the message. But schools, summer school, well, maybe we don't want to put those in. I'm not sure on that, but on the large events that have been held recently, and some notion of the outcomes as far as infections, I think might make the message more real.
Certainly, Commissioner. Thank you for that input. I appreciate it.
Thank you. Now, can we briefly address the question of alternative care site plan?
Sure. So with the activation of the incident management team, many of the actions that the state is taking are intended to relieve the stress on the healthcare system as a whole. As you know, we may be one county, but we don't have we have porous borders, and we're all interconnected in many ways. In terms of alternate care site planning, there was some planning with the hospital, some conversations that took place around some potential sites. I know that Samaritan has its own robust internal search protocol that goes quite far and allows for quite a lot of expansion within the campus. Laura, I wonder if you may be able to expand on that a bit.
I'd be happy to. Thank you, April. So I'll share that we have already expanded our urgent care center hours across the system, and I anticipate that we will be, and obviously we would welcome the opportunity to collaborate with Benton County Public Health to get the message out regarding those expanded hours. Obviously, we don't want to dissuade anyone who has a true emergency from coming to the emergency room, but an urgent care center is a useful and reasonable alternative care site for those who feel that that may be appropriate for their healthcare needs. And typically, urgent care centers, of course, they're not 24/7 the way that emergency rooms are. So we have been moving quickly to expand the hours so that we could capture more patients at those sites and decompress our emergency rooms. We also have talked about the possibility of working with our primary care physicians as well to identify maybe some spot areas where we could have extended clinic hours also to complement our urgent care centers. And then I would just quickly share, because I know this came up, and I just looked at a very narrow slice, but it coincides when we started to see some of those dramatic impacts from the Delta variant. But in terms of our inpatient admissions across Samaritan, right now the highest percentage are those 60 to 79 years, which is 41%, 40 to 59 years, 28%, 20 to 39, 22%, and unfortunately, ages 0 to 19 years is at 6%, which is now higher than those 80 plus years at 44%. I would caution that 6%, those 0 to 19, is most likely an understatement, because obviously when we get a critically ill pediatric patient, we would be doing everything we can to transfer that patient for admission to a children's hospital or a pediatric ICU. So I think it's important that is a key number. Very important to understand the implications around the 6% as an understatement in terms of what we're seeing. But the fact that even in our setting where we do not have a pediatric ICU, we have seen that eclipse the much older patient cohort at 80 plus years. Obviously, this is a change over what we've seen since the beginning of the pandemic. But to see those 40 to 59 years, vastly, quickly approaching a third of the patients, and of course that 20+%, those 20 to 39, we have absolutely seen a much younger population in the ICU than we did at the beginning and even the middle of the pandemic.
One more idea for messaging. I see letters, Trace talking, Governor Brown said this, and we don't like her, and I think from what I've gathered, the best spokespeople for messaging are people's primary care doctors. And I can see, imagine a list of doctors, please get vaccinated, please wear your mask, and that might get our message to some people that are ignoring our electeds' messaging.
Thank you, Commissioner. I do want to add, sorry, Joe.
April, go ahead, April, and then we'll follow with Joe.
Thanks. I just want to add that we have been sending several health alerts out to our providers, pharmacies, long-term care facilities, et cetera, including one last night that really urged all providers to route people to urgent care facilities rather than to EDs at this time. Laura, one thing I did want to mention is if there is a way that public health can help with further planning. You know, I've never been in a situation where an incident management team from the state has come down and said, we are going to relieve the pressure on the system. So our usual planning mechanisms of you know, activating a surge plan and looking at alternate care sites, things that we've done, you know, tabletop exercises over years to practice. It's different now. So if there is something that we can do to help facilitate that planning, something that we should be doing, please let us know. This is a whole new experience for most of us.
Yeah, thank you, April. I know we would welcome that, so I'm happy to follow up separately with you and Suzanne, and we certainly can identify the appropriate ways to integrate your team with our surge planning efforts here at Big Sam. We meet multiple times with in addition to what we're doing, as I said, assessing our scheduled cases and ER impacts. We also have a separate surge planning group, so I'm sure we can find the right ways to incorporate. And I would, I think it's important to just very quickly, I know since I'm on time, I would like to share one comment that I shared with Suzanne, and again, maybe we can find the right way to message this. I actually round every day in the hospital, and what I had shared with Suzanne is I think any way that we can continue to keep the human face on this, obviously that's to me one of the most important things. And I think because the community, the general public has been so inundated with data points, it's easy to dehumanize the data points and the fact that each one of these data points represent an individual. And so when I round on our nursing units, when I round in our ICU, we're averaging, last week we were averaging between 3 and 4 ventilated COVID patients on our ICU. And so when you see those individuals and understand that these are critically ill patients, and one of the things that has really impacted me is not only understanding that this is, someone's loved one, an individual from our community who may no longer be in our community. I also think about the fact that we have caregivers who are experiencing death and loss at a much higher rate. So again, we become almost numb to talking about, burnout. We talk a lot about clinician burnout, and we did talk about it before the pandemic, but now it has taken on a much different meaning in terms of what these individuals are experiencing. And then at the same time, we have loved ones really behaving in a way, we all know about the political aspect of the masking and not being vaccinated, and the way that our caregivers are being accosted about that when we're really trying to promote data-based, scientifically based medicine and care. It is truly a much different place than any of us have experienced in healthcare before. So again, anything that can bring back the human aspect, and that these recommendations are, it comes from a place of seeing these individuals suffer and their loved ones suffer, and people who are caring for them suffer in a way that we've never seen before. So I just would offer, and Suzanne and I had a very thoughtful discussion about that, any way that we can keep the human face on it, in addition to the numbers, is enormously useful.
Thank you, Laura. Joe, and then I think I want to wrap this up so that we can move on with our agenda.
Thank you, Commissioner. I was just going to ask for an expanded conversation regarding the alternative care site planning, but the information that April shared and then Laura shared, I think will suffice for my needs for the time being. I just think it's really important that we have a coordinated effort as it relates to this, and I do recognize, April, that things have changed with the action that the governor has taken relative to pulling together resources at the state to accelerate or advance this planning. And yet I want to make sure to recognize the work that our EOC did probably a year ago surrounding alternative care site planning, and Brian and several others of our staff are very involved in that, and just want to make sure that we're actively engaged with Samaritan and others, and that that planning is going on so that we are looking forward as to what we're anticipating, and that we're putting plans in place, for lack of a better term. So on that note, Commissioner, I don't think I have any further questions other than encouraging April and Suzanne and Laura and others to really come together on this alternative care site plan.
Thank you. And I do want to also mention that Dr. Thompson reached out via chat and let me know that he's been having ongoing conversations at our public health staff with Oregon State University, both at the leadership level and athletics. And OSU athletics is definitely coming around to realizing that they need to accept masking, at least at some points in the process when people are at games, when there's not a possibility of maintaining physical distance. So I think we have more work to do there, but our mask mandate will make a difference. So whether it's a 100, 200, or 300 level threshold, all of those will affect OSU athletics. So we will make a difference. Okay. Any closing thoughts before we leave this topic? We will be coming back to it later this afternoon, as you all know, in agenda item 8.2. And with that, I am going to take a 5-minute break, give us all a chance to stretch our legs before we welcome Nick Kirk to have our next discussion about the Justice System Improvement Program calendar. So thank you. Thank you all.
County Administrator, thank you for having me again this morning. I caught most of the last conversation and presentation, and it would be a disservice if I didn't say I was moved by it, and I'm a little bit distracted, but let me forge ahead with today's topic on the Justice System Improvement Program, which is really to lay out not just the calendar from now through March up to and including filing the bond measure for the county clerk, but more importantly, expectations, key decision points. Before I dive in, I want to share with you that there's been a recent turn of events, which probably does overshadow this presentation and will certainly be taken up in Ops team today. We learned early this morning that 509J missed its filing deadline and will be moving to its backup date in May of 2022 for its local option levy renewal. And so as recently as about a week ago, I had consulted with 509J's CFO on their intentions, and it was still to go in November, but that has now since changed. With that, let's go ahead and see if we can make up a little bit of time here today. I updated the slide this morning, woke up and decided I still wasn't happy with the presentation. I'm going to go through this very methodically, and please interject with any questions. It's a lot of data points, and so I want to make sure everybody understands what we're looking at from now through March, if indeed we continue to move towards our May 2022 bond date. So first of all, we have a large public meeting on September 8th. There are no recommendations from the county at that point relative to a proposed solution. It's an extension of our smaller targeted meetings that we're having now, where we lay out the possibilities and options and invite public feedback. That is followed by our second large public meeting on October 6th, and you'll notice that the bullet points have changed to check marks, and that is to indicate that there will be board input for that event, and that is built into the calendar, the PDF calendar that I shared with you as well. So at our second large public meeting on October 6th, we are now presenting draft recommendations. The message there is we've been conducting public outreach. Here's what we've heard. Here's what we think we've heard, kind of the direction we're heading in. But we're presenting at this point with some recommendations on sites and facilities and the other questions. It's not cast in stone. We'll take input as well, but we are making some recommendations. Sometime in October, land acquisition reimbursement resolution will come before you. Mariotny and I are working on that. That simply allows the county to reimburse itself for any property purchases made prior to the bond measure. So that applies to 2 potential property purchases. By October 31st, we have to essentially decide on the chosen suburban property. And that date is driven by, I think as you know, one of the properties in the south, we have an LOI, and that particular seller cannot wait until we have a bond outcome. And so through use of extensions, we can push that decision point till the end of October and no further. Finally, on November 2nd, that's our drop dead date for final recommendations to DLR. And what I mean by that is site facilities, where the courthouse is located, and whether there's, whether the historic courthouse is part of the bond measure. That date is driven by DLR's need to have time in November and December to do final costing analysis and taking into account the holidays. Pretty rigorous process. They have to get those costing numbers exact because they drive our bond documents that we file. So that's the drop dead date. Let me just pause there and ask if there's any questions about those first 5 bullet points from any of the commissioners. Joe. And again, I can't see everybody. All right, I'll keep moving then. In the December-January timeframe, this is when we have to solidify our bond strategy, working with our underwriter, Mary and myself. We'll be making decisions about bond amounts, and you'll notice I have plural there. We may, in fact, have multiple bond issuing and timing, depending on how we want to structure the bond offering. This is something that 509J took advantage of. It has to do in part with tax-exempt status and how quickly the money has to be spent. We'll also have to make decisions about whether we're doing any full faith and credit borrowing, which is what we did for 4500 Research Way versus the general obligation bond. So it'll be a pretty rigorous exercise. There's a fair number of options to consider. I did talk to Mary yesterday about potentially forming a bond committee, similar to what Bond Oversight Committee. Haven't advanced that discussion any further, but it's one that we probably want to have in ops team and with the commissioners. This is a strategy employed by 509J. So more to figure out relative to the bond on issue and preparation. And then finally, February 15th, we'll need to approve SEL 805, that's the ballot title. And by March 1st, approve SEL 801, which is notice of a measure. That gives us about a 2-week buffer for actually filing the SEL 801, which is typically the buffer we like to have. I conferred with Vance Crony on that, and so his preference as well. So that's all leading up between now and essentially March 1st. In terms of the decisions that will have to be made by November 2nd, again, we will have to know what sites we're proposing, what site or sites, what facilities, the location of the new courthouse, and repurposing of the historic courthouse. All of those will essentially drive a bond amount. This is the new calendar. I just wanted you to know that the dates that I've shared today are being driven by the 2022 local elections calendar, so that there won't be any follow-ups. Just got that from Darla Rush yesterday morning. And then I'm going to segue to the PDF because it's really the representation of what I've just described and where checkpoints will be with the Board of Commissioners. So this is our September 1 date, large public meeting. We expect comments to trickle in for about another week. And we will have 2 checkpoints on Tuesdays at the end of September to start honing our recommendations with the intent of coming to our second public meeting with kind of a feel for what we're proposing. Again, we expect comments to trickle in for about a week. And then we'll go through a more rigorous exercise, which is really making our final decisions to meet this November 2nd date. Also, by the same second half of October time period, we're going to have to decide what our chosen property is and potentially enter into a public and sale agreement with one of the parties. So that will have to happen by the end of the month here. Once we've made our recommendations to DLR. They go back and do their work. We start working on our own bond strategy with our underwriters, so that'll consume essentially November and December. In early January, DLR will come back with hard costing data. We will have enough information to work on our bond strategy in this 2-month time period, but we'll get hard costing data here. We'll have some time to process and assimilate that, and then we will present that to the commissioners for the first time, along with our bond issuance strategy about the end of the month. And then moving into February, FCL 805, which is the title, has to be filed here. I think that's the 25th. We'll probably shoot for either the 1st or the 15th there for approving that document. So between these 3 checkpoints, we will be honing the language for the title. And frankly, the title is almost as important as the bond measure, highly leveraged. So this will be important work in terms of being able to articulate what our bond measure will be. And then finally, at this March 1st date, we'll approve 801, and Vance will walk it over to the courthouse sometime for the, is that 17th, I guess? Having a little trouble reading it myself, but that's the plan. I'm going to stop sharing unless you want me to leave this up.
So at this point, Nick, you're ready for questions and discussion?
I am, thank you.
Okay. As you all can see, it is a tight timeline. There's not a lot of slack. We use much of our slack in this process in the last couple of months as we were really honing in on sites. So we have some decisions to make moving forward. The ops team will consider those and bring decisions to the board. The other thing I wanted to point out is that typically our fourth Tuesday of the month is not a decision-making board meeting. It has been an information sharing board meeting where we typically hear presentations from outside groups or just informational presentations from internal staff. But as we move forward into this fall and into winter, we will be using that meeting as a decision meeting and have some pretty significant discussions through that time. We have a big decision coming up with respect to the whole timing question. The other timeline that's not represented by Nick at all, of course, is the campaign timeline. And I have been working with Rayfield's assistant Brian to try and find a date when the 3 of us commissioners might meet with the legislator on a very political campaign basis, not the county decision-making process, to focus on that campaign. So we will have a whole separate calendar paralleling this one that we need to start laying out in the next 2 or 3 weeks. And lastly, I do want to mention that we have a lot of attention in the community. I can't go anywhere without hearing about this right now. People are asking me about it all the time. And I would hate to lose the momentum that we've built and that we are continuing to build with our community engagement by deferring to a different election cycle. So that's just something we're going to have to discuss and figure out as we move forward. Pat?
Yeah, I'm disturbed that 509J is going in May. Is that a firm calendar on their part?
Well, Joe was notified by James Morales that they missed their filing date. So it feels like that ship has sailed. As I mentioned, I had an email as well from their CFO to that effect, as I had just reached out to her about a week ago on their intentions. So I don't know that it can be undone. Joe?
Commissioners, I'd like to just interject real quick. Within the last couple of minutes, I received an email from our administrative staff that the superintendent did reach out and request to speak with me. He's not available until after 4 o'clock this afternoon, so I will in turn give him a call at that point. So I hate to surmise too much regarding what's going on with the school district. At which time I talk to the superintendent, I can tell you, as Nick just shared, that according to our county clerk, the school district has not met the current time frame for getting something on the ballot in November. But that's what I can tell you at this point, and I'll certainly update folks once I've had a conversation with Ryan Moss later this afternoon.
But just to follow up, putting 2 money measures on one ballot is a mistake. And I mean, I would defer to the more politically savvy folks and look at history, but this effort is a tough sell, and a lot of moving pieces, and to kind of dilute our message with school levy. I think that doesn't help us.
No, it's a tough position. I'm respectful of Commissioner Rosero's observation that we've gained a lot of momentum. I will say, though, at the same time that I recall both Kurt Wright, when I way more than a year ago, as well as DLR's Justin Strandl said, you don't want to go up against a school measure, and so we're in a strange place, and it was certainly never our intention. In fact, when we were, when I initially put together the calendar of municipal measures, and we chose May because 509 was supposed to go in November, and even had a discussion that if their measure failed, they were planning to come back in May, and we would then probably have a discussion about what we would do. So we're at that point, unfortunately.
Nancy?
So while I am surprised at that news, I think that, Joe's gonna hear from Ryan Noss, and if it does turn out that they're gonna go in May, then, I think the silver lining is we have all become very good at pivoting over the past year and a half of COVID. I think if we have to move to the November ballot, which obviously is gonna be an ops team decision, I think that's okay. I do share the same concerns about losing momentum. However, I have also had concerns about public outreach and public input, and feeling a little bit rushed there. So, if we do have to move to November, I would say the upside is we have a little bit more time to focus on the public engagement piece. But I think it will be fine.
Thank you. I agree. The other consideration is just based on the hours-long presentation I heard preceding this, we really don't know what the situation will be relative to COVID in May. And that's always been a conversation piece relative to our timing for JSIP as well. So appreciate your comments, commission-wise.
Well, thank you, Nick. It looks like we might have to have a next iteration of this calendar, but we will know in the next few days. So I guess the one saving grace is that we did get that news today, so that it was part of this discussion rather than later. So
right, and we will be making room for it on ops team agenda this afternoon. So we should be able to come back with a recommendation quickly.
Sounds good. Okay.
Right.
Any other questions for Nick? Okay, hearing none, we will move on. Thank you. We have our business meeting up next. The consent calendar does not take much time. Public hearings cannot start before 11. So would you prefer to take a quick break now? Okay. Let's be back at 11 sharp. Thank you. meeting shortly.
Yes.
So we are beginning our business meeting with item 5, the consent calendar. Do I hear a motion to approve the consent calendar?
Move to approve the consent calendar.
Second.
All in favor, please signify with an aye.
Aye.
Aye. Thank you. We will move on into our public hearings, beginning with public hearing number 1 in the matter of a hearing and first reading, revising our floodplain codes, ordinance number 2021-0304. Toby Lewis, Community Development, will be presenting, and she did send us an email message this morning with some updated language, which she will explain when she presents to us. With that, I would like to open the public hearing number 1. Toby?
Sorry, there we go. Okay. So many mute buttons. Okay, so this hearing is for adoption of the revised floodplain code revisions that are in our development code. We've been working on it for the last several months, and right now, at this point, it's gone through the Planning Commission on July 20th, and they have recommended approval of the proposed changes. There was a work session with the board on August 3rd so that you could have a chance to see what those revisions look like ahead of time, because there's a lot that we're doing with this. The thing that was prompting these code revisions is that we are currently working through a 5-year audit of the floodplain program with the National Flood Insurance Program Community Rating System. Participation in that program ensures that we are continuing to maintain our higher regulatory standards that we have in Benton County, as well as maintain the minimum floodplain development standards that FEMA requires. Part of the community rating system program has been revamped a little bit, and they've changed some of their minimum standards. And so revising our code was partly prompted by that. The timing is entirely driven by the 5-year audit, but revising our code also will complete one of the audit requirements through the state and FEMA for a community assistance visit, which is supposed to be done every 3 to 5 years, but unfortunately FEMA often doesn't have the ability to complete those audits, so we have an ongoing community assistance visit that's been in place for a couple of years. We're just slowly working away at various items that need to be addressed, and it's only ongoing because the state hasn't had the opportunity to finish that up and help get that closed out. So for the code revisions that you're seeing, we opted to revise our current flood chapter 83 so that it is aligned with the state model floodplain ordinance to make it easier for documentation during these audit processes, so that we don't have to keep pointing to a bunch of different places in a completely different order than what is set up for the audit process. So it looks like there are a lot of revisions to our code because we just reorganized a lot of it. There's also a lot of administrative language that we're required to add to meet FEMA's minimum standards and ensure that our code is compliant that way. It's not really substantive language, it's just for administrative purposes, and we just have to have it in there. The attachments that were included with the agenda packet include a table that has cross-references between the current code numbers and the revised code numbers, quick notes about what was missing or added or changed, and then there's an attachment for the proposed new code. That's that side note saying where existing code was pulled in or if we were changing something, that's noted there as well. the key things are that we're changing are the access and buildable area standards. So those are in section 83.520, subsection 2. It's under parcel and lot design standards. And if you're trying to find that, it's in attachment 5. It's on page 31. So basically what we were doing there, we had current code language said that any time somebody is dividing land or adjusting their property boundaries, their property line adjustment, they needed to ensure that there was suitable and adequate building site left on each parcel if that was appropriate. This language came pretty much straight out of our comprehensive plan, which doesn't include a lot of specifics or details, and so the inclusion of that language the way it was made a very subjective determination, and then also later triggered the need to change our property line adjustment chapter so that we had 3 levels of review and 3 levels of fees and things like that. So what we've done there is identify very specific minimum standards for what suitable and adequate means. Ideally, it'd be nice if there was, like an acre or 2 acres of land outside of the floodplain on a property available for building and siting septic system, but the standards that are identified in this section are meant to be the bare minimum that would be needed to at least site a dwelling and hopefully part of the septic system. The goal being that we want to keep the structure outside the floodplain at an elevation that's higher so that when there is a 100-year flood, the structure will stay dry, even if the rest of the property is. The other adjustments we made to this section were the access standards. So the code currently requires coordination with the fire districts and documenting that when you're dividing land, that the access or the driveway from the building site to the road will be located, the elevation of the driveway will be entirely above the flood hazard area if you're dividing land, or the flood elevation if you're dividing land. So we were informed by the state that although the goal of keeping people safe and able to access their building site from the road to is very admirable, that code language actually encourages adding fill to the floodplain and altering the ground in a way that could actually create more hazardous conditions and increased flooding problems. So we were told that language should be removed. We couldn't remove it entirely because of the way our comp plan is worded, but we did come up with an alternative that worked for the state and should still work for the comprehensive plan. And so the proposed language says that if any portion of your driveway is going to be underwater during a flood event and you're dividing your land, then you need to provide a profile of what the ground elevations are along that driveway and note what the flood elevation is so that everybody's aware when the land is being divided that that driveway may be or will be underwater during the 100-year flood event. The other thing that they need to do is sign a covenant to put future owners of the property on notice that they may or may not be able to access their building site during a flood event, and also that may impede emergency personnel from accessing that site during the flood event. The other section, or the other 2 changes that we chose to implement were regarding, sorry, before I move on, does anybody have questions about the land division or the building site and access? Okay. Okay, so then the next one is accessory structures. That's in section 83.650 on page 36 of that attachment 5. That is language that's encouraged to be added by the state. It's not required that we do it, but it does go back to some code requirements that we had before 2011. So prior to 2011, we were allowed to permit accessory structures, so things like barns, garages, shops, in the floodplain with floor elevations that are lower than the flood elevation, as long as they provided venting to allow water to flow through that structure during a flood event. In 2011, we were required to remove that and require all of those structures, new structures, to be elevated with the floor 18 inches above the floodplain or flood elevation, just like a regular house. And while that's a good thing for people to do, it's not always very practical. So we have, like barns on large farming properties and things like that. Sometimes that requirement means that they have to elevate those structures about 4 to 6 feet in the air, and that really doesn't work for the uses that are occurring in the structures. So recent FEMA guidance has allowed for permitting small accessory structures. They have to be 1 story. There's a maximum square footage on them. And if they meet those certain requirements, then we can allow them as with the floor elevation at grade, or encourage them to elevate it a little bit if they can. We've also added in a covenant requirement if they're doing that, that they have to sign and have recorded for their property to make sure that people are aware that the structure is expected to have the floor underwater and have water flowing through it during a flood event. So that works for if you have a house on a property and you want to build an accessory structure, and it is not going to be for as habitable space, so garage, shop, those kinds of things. It does not work for things like accessory dwelling units. That doesn't qualify as an accessory structure. It doesn't work as for art studios or anything where somebody's going to be spending some time in a furnished, a finished space. The other part of accessory structures is that in section 83.400, that's our minor variance section. Currently, the minor variance option is available for any accessory structure, and that was a result of having to change those requirements back in 2011. Because we can now allow accessory structures that meet the first set of criteria without a variance, the minor variance section has been targeted specifically towards agricultural structures. This is also based on current or recent FEMA guidance that agricultural structures, when they are larger than those accessory structure requirements, can also be permitted with the floor elevation at grade instead of requiring them to be elevated, as long as they go through a similar process of making sure that they have the flood vents to allow the water to flow through, and then we're also putting that covenant requirement on those. The term agricultural structures, as it's used for the minor variance section, is a bit different than the term agricultural structures as it's used for building code, where we're talking about agricultural exemption from building code requirements. So we had to adjust our definition of agricultural structures at the beginning of the chapter a bit to clarify that, because for the minor variance portion, it is targeted more towards how the structure is used and not whether it qualifies for that agricultural exemption process. And agricultural structures don't qualify for the agricultural exemption process anyway, because if they're in the floodplain. So they still have to get regular building permits for that. Any questions on either of those two items? Okay. So then the last thing would be the email that I sent you earlier today. So there was a slight revision that we needed to make to section 83.230. This has to do with the conditional letter of map revision requirement. And so the way the draft code was presented in the agenda packet was based on model code, but it's a section of the code that we actually have the ability to adjust a bit to better fit our current policy. The majority of the changes are in subsection 3 of that section, and then subsection 3C. So currently, there's a requirement that, So there's a requirement that an applicant submit a conditional letter of map revision So that's an application that gets turned into FEMA saying, okay, I have a project and I would like to implement it this way, and asking for FEMA's official response on how they think that will change the elevations in the floodplain. That conditional letter of master revision can be applied for a number of reasons. Mostly it's for the reason that I just explained, but lately it's also been being applied for as documentation of Endangered Species Act compliance. And when it's being applied for in that way, there's no reason, and not for a change of the flood elevation, there's no reason to follow it up with the letter of map revision process. And so subsection 3C, the way it's written right now, would still require the letter of map revision to be applied for, which increases applicant costs unnecessarily if they're just submitting the conditional letter of map revision for the Endangered Species Act compliance. So the other thing that the way the proposed code doesn't do right now is identify projects that need a letter of map revision approval from FEMA, but don't need a conditional letter of map revision. So that would be things like large culvert replacements or bridge replacements, or projects where the flood elevation will not be increased based on the proposed project, but the boundaries of the flood hazard area will widen. And so the changes that I emailed to you are meant to reflect all of that and make sure that the code is requiring conditional letters of map revision and letters of map revision in accordance with our current policy. So any questions on that?
Here, I do have a question. Because I'm wondering how much effect some of this new language will have on typical stream restoration projects that are engaged in by our watershed councils and in partnership with landowners. As I understand it, any one of those projects now has to go through the conditional letter of map revision process?
Usually, yes. So if the project is just, like vegetation replacement, removal of invasive species and replanting of native species, then those types of projects don't have to go through this process. But if they're installing large woody debris, root wads, or they're altering the way the flow of the creek, or they're doing a culvert replacement, those types of things are alterations to the water course, which then triggers that potentially the conditional letter of map revision, but for sure the letter of map revision upon completion. And so that's what these changes are meant to capture, because right now we're just doing that by policy. So it's meant to make it clearer and have specific criteria to point to when we're working with watershed councils and other people that want to do stuff.
But it does also definitely extend the timeline for any of those projects, and it would require an additional level of engineering analysis, correct?
Yeah. And unfortunately, that's just kind of what we're dealing with right now. Hopefully we'll have something different or better, preferably better, as the Endangered Species Act stuff works through FEMA and gets hammered out, and hopefully they will come up with a quicker, easier process for some of that. But yeah, for now, that's what we're doing now.
A programmatic approach, as they say, rather than case by case. Yeah, it definitely will slow down restoration activity. But I understand the rationale. Thank you.
So that's pretty much all I had. Just if you are okay with the proposed changes that I sent via email this morning, when I talked to Greg the end of last week, he said that those changes would need to be read into the record, and then it would be the second option for the motion instead of the first.
If there are no further questions for Toby, I would entertain a motion.
I'll move to conduct the first reading for adoption of ordinance number 2021-0304 as modified at the public hearing, revising the development code as proposed in the planning file number LU-21-032.
Second.
Okay, is there any further discussion? Well, no, actually, I have missed a step. I apologize. I did not call for any public comment. So let's put that motion on hold. Is there any public comment on our proposed changes to floodplain chapter and ancillary chapters as described by Toby Lewis? Okay. I will then go back to the motion on the floor. All in favor, please signify with an aye.
Aye.
Aye. Aye. And I will close the public hearing, and I will read the amended language and the short title. Before the Board of Commissioners for the State of Oregon, County of Benton, in the matter of amending the floodplain regulations of the Benton County Development Code, specifically chapters 51, 57, 83, 88, 94, 95, 97, and 99, ordinance number 2021-0304. Short title, amendments to the Benton County Development Code regarding floodplain development. The second reading will occur on September 7th, 2021, and the effective date will follow 30 days later on October 7th, 2021. The language submitted today pertains to 83.230 requirement to notify other entities to submit new technical data. 2, water course alterations. C, the applicant should be required to submit, when required, a conditional letter of map revision and a letter of map revision pursuant to Benton County Code 83.2303. As a condition of permit approval, the applicant shall be required to ensure compliance with all applicable requirements of Benton County Code 83.2303. The next one is that paragraph 3, requirement to submit new technical data. The new language reads, the floodplain administrator shall require a letter of map revision or lower to be completed within 6 months of project completion for the following circumstances. For projects that will expand the boundaries of the special flood hazard area regardless of their effect on the base flood elevation, or for bridge and large culvert installation or replacement projects regardless of their effect on the base flood elevation. And C, when an applicant has obtained a conditional letter of map revision except as specified in subsections 1 and 2 below. 1, if a conditional letter is obtained for the purposes of documenting compliance with the Endangered Species Act and the project will not cause a rise as specified in BCC 83.2303B, then a letter of map revision is not required, or if the conditional letter of map revision is obtained and the applicant subsequently alters the project in such a way that it no longer causes a rise as specified in Benton County Code 83.2303B, then a letter of map revision is not required. Note the exceptions listed in subsections 1 and D2 above do not, I think that's an error. Section 1,
yeah, it is. I'll fix it.
Do not apply to projects that meet the criteria in Benton County Code 83.230CA or B. Okay, so we will return to this on the 7th of September for the next hearing. Thank you, Toby.
Thank you.
Okay, moving onward, our next hearing is in the matter of public hearing and potential first reading extending Benton County Code Chapter 20, Interim Vehicle Camping. Rebecca Taylor will be presenting from Community Development, and the public hearing is now open. Rebecca, would you please present?
Commissioner Teresa was checking on Rebecca. I'm not sure she is out there as we speak.
Okay. We can always take this out of order and skip to public hearing number 3. So let's do that. I'll close public hearing number 2 for the moment and return to it. Public hearing 3, in the matter of public hearing regarding the annexation of property within the Dumbeck Lane Domestic Water District into the North Albany County Service District. Gary Stockhoff from Public Works will be presenting, and I now open the public hearing and invite Gary to present the matter.
Thank you, Commissioners. Good morning, everybody. This is a process that began earlier in the year when the Dumbeck Lane Water Group or District requested annexation to the North Albany Service District. They were struggling with getting folks to participate and have enough people to be on the board. And so we worked together with Bo Price in particular, and Chris Bailey, Peter Trueston with Albany, and Joe, and then Vance to move the ball forward. So what you see today is the procedures to make this annexation happen, and it was very prescribed by Oregon law. Vance has done an excellent job, even though he decided to go on vacation this week and not take credit for it. Laying this all out, so I'm not going to spend a lot of time going through the ins and outs. I think he's laid that out very well in the report. A couple of things I would like to mention, though. One relates to the outstanding loan the district has with Business Oregon. As we've stated in the report, the proposal was brought forward that the district put together their capital reserves, their loan payment reserves in cash, and pay off as much of that loan as possible. The loan outstanding balance was roughly $425,000, and they have roughly a little over $400,000 that they have available. There'll still be money to run the district until the annexation takes place in a couple months. But we would be able to pay off, they will be able to pay off the majority of that outstanding loan. The remainder would be the responsibility of Benton County per Business Oregon requirements. We have not decided yet whether we'll go ahead and just pay that off and figure that out later, or if we'll go ahead and assess the remainder to those property owners who have not already paid off their obligation. And that was one thing in the report. It stated that it would be spread across the folks in the district. There are several people in the district that have already paid their obligation for that loan off, so it would only be those who did not or have not already paid it off. Albany and Benton County are working through that right now, so we'll still need an agreement of some kind or an amendment to the IGA to reflect how we're going to handle that, and that will be happening in the next month or so as we get that resolved. And also that Albany will need to formally say, yeah, we're willing to do this, and then extend the water. So there's a lot of business activity going on here between Albany and their side of it and our side, but we have everything lined out to meet the statutory requirements to make the annexation happen. So today, you're being asked, I believe, to first reading and adopt the order, which has, again, Vance has laid everything out in that, and set the public hearing, the second one, which is September 21st, at which time we will come back and finalize that and conduct the public hearing both today and then a month from now. So with that, I know that Chris Bailey from Albany is on this call or on this meeting, and I know that I believe Bo is also on this. So if you have any questions or comments, we can sure entertain those now.
Question for Gary. Pat.
Not really a question, but a comment. This from what I've seen, is a nice process of different entities working together to solve a pretty serious problem for those folks that are affected. And I appreciate volunteer organizations running out of steam at some point, and so I think the partners that have stepped up to make this get this problem solved are to be congratulated. It's nice to see government working, and it takes a while, but I think this is a good example of being successful.
Thank you for those words. If there are no further questions for staff, I will ask for public comment. Is there any public comment on this matter?
This is Bo Price. I could maybe add something from the Dumbeck.
You're most welcome.
Okay. I agree with Pat. It's been great working with Benton County and City of Albany and getting this. I've been on the board of Dumbeck since 2001. I've been on the board for 20 years. Seen a lot of people come and go. Sometimes they last for 2 months. Sometimes they last for 2 years. We've done a lot of the hard legwork in getting the district to where back in 2007 we major renovation and replaced actually most of the infrastructure pipes and meters and radios, and upgraded to radio read, and just really got it to a point of running fairly smoothly with very few problems. And we still can't get people to be on the board, and it's been very good that Albany, and it kind of made sense for us to merge into North Albany County Service District, which is basically surrounds our district, and incorporate into that. And we're ready to just kind of let it run by Albany totally, because right now they manage everything for us except for bill our customers and collect our cash. Other than that, they do our maintenance, and we've got our IJ with them. So it's going to be a very easy, I think, step for them to move into fully integrating us into the North Albany District, County Service District that already exists, that they're working with. Anyway, that's kind of why we're at this point. We just figured it's time, because right now we've got 2 seats open and haven't had people really wanting to. They get their water and they're happy. So it's like, well, why? I don't have time for that. Like, yeah, I know, but it's ours. So I appreciate working with Gary and Chris and Vance and Joe and everything. And if you have any questions for me, I'd be happy to give any more information.
Thank you. Appreciate the history and the emotion. Any questions for Bo? Anything else to add, Chris, from the perspective of Albany?
I'm sorry, I'm trying to find all the buttons. No, thank you, Commissioner, for asking. As I think Gary and Bo have summed it up, this is just another step, and then there's more work to do. So you'll see the updated IGA coming back, which will also have to go to Albany City Council, and hopefully we can get that to a place where everyone just agrees that it's fine, and we'll just keep moving forward.
Thank you very much. Sure appreciate it. Okay. Any further questions or any other public comments? Hearing none, I would entertain a motion.
Well, before I do the motion, I'd like to thank Bo for hanging in there for 20 years. That's an impressive voluntary effort, and so thank you for keeping things running for that long. But to the motion, I move to adopt order number 2021 days.
Mr. Malone, if I can just interject real quick, Commissioner Osro, you should close public comment before Commissioner Chapman, the motion.
I will now close the public hearing.
And I will move to adopt order number 2021-60 to annex property within the Dunbeck Plain Domestic Water Supply Special District into the North Albany County Service District and hold a second public hearing as described in the order, and I think that's September 21st.
Second.
Okay. This is an order, not an ordinance. I'm not sure whether I need to read it. Without Vance here, I am lacking in guidance. But to be safe, before the Board of Commissioners for the State of Oregon, County of Benton, in the matter of approving the annexation of property within the Dunbeck Plain Domestic Water Supply District into the North Albany County Service District, pursuant to ORS 198.850, order number 2021-061. Okay, and we have a motion on the floor. All in favor, please indicate with an aye.
Aye.
Aye. Okay, and as Commissioner Malone stated, the next and final hearing will be on Tuesday, September 21st at 11 a.m. Thank you. That took a lot of us to get this far.
Thank you.
Okay, moving back to public hearing number 2, we will take up the first reading extending Benton County Code Chapter 40, Interim Vehicle Camping, and Rebecca Taylor has joined us from Community Development. Welcome, Rebecca. I open the public hearing and invite the staff report.
All right, so I met with you guys on July 20th. We discussed extending the interim ordinance for Chapter 40, which is for 3-vehicle camping on religious institutions, and the need to extend that sunset date that was originally for this December into 2022 on December 31st to enable the public outreach that we had discussed when we adopted the emergency ordinance. That this interim would give staff time to conduct that public outreach to enable this ordinance to be most responsive to our community needs. So today I have before you the exact same code language as far as the criteria and the standards with 3-vehicle camping code. The only change is that the sunset date is December 2022. So that will provide us that additional time.
Thank you, Rebecca. Are there questions for Rebecca? I wanted to point out for anyone that's listening, we have only had one applicant so far, but there is one site that is being used, or one church has volunteered to house vehicles for camping. Okay, is there any public comment? Anyone who wishes to testify, please unmute and speak now. Okay, with no public comment, I will now close the public hearing, and I will entertain a motion.
I'll move to conduct the first reading of the ordinance extending the sunset date of Benton County Code Chapter 40 from December 31st, 2021 to December 31st, 2022.
Second.
All in favor, please signify with an aye.
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 Aye. Thank you. Before the Board of Commissioners for the State of Oregon, County of Benton, in the matter of extending the sunset date of Benton County Code Chapter 40, Vehicle Camping at Religious Institutions, Ordinance number 2021-0305. Support title, extending the sunset date of Benton County Code Chapter regarding vehicle camping villages to machines. The second reading will occur on September 7th, 2021, and the effective date will be October 7th, 2021. Thank you, Rebecca. Okay, moving onward to public hearing number 4. Matter of a public hearing regarding an intent to apply for $250,000 community development block grant for CDBG funds for the Benton food share. Mary Otley and Rachel Matthews from Square Consulting will be presenting. I now open the public hearing.
Good morning. Good morning, Commissioners. This is a requirement of a CDBG grant that we are going to be applying for in the amount of $250,000. The funds will be transferred to Benton Food Share to be used for storage facilities, transportation to the outlying food bank areas, so it'll be dispersed throughout the county. One of the requirements of a CDBG grant is that we have a public hearing, and that notice of said public hearing be published in the local newspaper, both in English and in Spanish, which it was. This is, Rachel is our CDBG grant, knows everything about it, but this is one of the requirements, and one of the requirements is that we also read the notice in this public hearing. And so I will read the English one, and John Pegg has agreed to read the Spanish version. Are there any comments before we go into reading the notice?
No, thank you.
All right, I'm working my way down to the notice here.
Page 3.
All right. Yeah, I took my part out, so I don't have a, yeah. Public notice and notice of public hearing. Benton County is eligible to apply for a 2020 Community Development Block Grant from the Business Oregon. Community Development Block Grant funds come from the U.S. Department of Housing and Urban Development. The grants can be used for public facilities and housing improvements, primarily for persons with low and moderate income. The state expects to receive approximately $13 million in new federal funds during 2021 for grants to non-entitlement cities and counties for eligible projects. The maximum grant that a city or county can receive under the COVID-19 Impact Assistance Program for food bank assistance activities is $250,000. Benton County is preparing an application for a 2021 Community Development Block Grant from the Business Oregon for food bank assistance for low to moderate income residents living in Lynn and Benton counties. It is estimated the proposed project will benefit over 10,000 low to moderate income residents each month. The public hearing will be held by the Benton County Board of Commissioners at 11 a.m. on August 17, 2021 at 205 Northwest 5th Street, Corrales, Oregon, 97330. The purpose of this hearing is for the Board of Commissioners to obtain citizens' views and to respond to questions and comments about community development and housing needs, especially with low and moderate income persons, as well as other needs of the community that might be assisted with the Community Development Block Grant project and lists of proposed projects. Written comments are also welcome and must be received by August 12th at 205 Northwest 5th Street, Corrales, Oregon, 97330. Both oral and written comments will be considered by the Board of Commissioners in deciding whether to apply. The location of the hearing is accessible to persons with disabilities. Please contact Teresa Farley at 541-766-6890 if you will need any special accommodations to attend or participate in the meeting. More information about Oregon Community Development Block Grants, the proposed projects, and records about Benton County's past use of Community Development Block Grants is available for public review at 205 Northwest 5th Street, Corrales, Oregon, 97330 during regular office hours. Advance notice is requested. Special accommodations are needed. Please notify Teresa Farley at 541-766-6690 so that appropriate assistance can be provided. Permanent and voluntary displacement of persons or businesses is not anticipated as a result of the proposed project. If displacement becomes necessary, alternatives will be examined to minimize the displacement and provide required reasonable benefits to those displaced. Any low and moderate income housing that is demolished or converted to another use will be replaced. And John, your turn.
Bueno, aviso público y aviso de audiencia pública. El condado Benton es elegible para solicitar una beca en bloque para el desarrollo comunitario 2020 de Negocios Oregon, the 2020 Community Development Block Grant from the Business Oregon. Los fondos de la beca en bloque para el desarrollo comunitario provienen del Departamento de Vivienda y Desarrollo Urbano de los Estados Unidos. Las becas se pueden utilizar para edificios públicos y mejoras de viviendas, principalmente para personas con ingresos bajos y moderados. El Estado espera recibir aproximadamente 13 millones en nuevos fondos federales durante 2021 para becas a ciudades y condados sin derechos para proyectos elegibles. La beca máxima que una ciudad o condado puede recibir bajo el programa de asistencia de impacto COVID-19 para las actividades de asistencia del Banco de Alimentos es de $250,000. El condado Benton está preparando una solicitud para una beca en bloque para el desarrollo comunitario 2021 de Negocios Oregon, para asistencia del Banco de Alimentos, para residentes de ingresos bajos a moderados que vivan en los condados Lynn y Benton. Se estima que el proyecto propuesto beneficiará a más de 10,000 residentes de ingresos bajos a moderados cada mes. La Junta de Comisionados del Condado Benton llevará a cabo una audiencia pública a las 11 a.m. el 17 de agosto de 2021 en el 205 calle 5 noroeste, Corvallis, Oregon 97330. El propósito de esta audiencia es que la Junta de Comisionados obtenga opiniones de los y las ciudadanas y para responder a preguntas y comentarios sobre el desarrollo de la comunidad y necesidades de vivienda, especialmente las necesidades de personas de ingresos bajos y moderados, así como otras necesidades en la comunidad que podrían ser asistidas con un proyecto de beca en bloque para el desarrollo comunitario y el proyecto propuesto. Los comentarios escritos también son bienvenidos y deben recibirse antes del 12 de agosto en el 205 calle 5 noroeste, en Corvallis, Oregon 97330. La Junta de Comisionados considerará tanto los comentarios orales como los escritos para decidir si aplican. El lugar de la audiencia es accesible para personas con discapacidades. Comuníquese con Teresa Farley al 541-766-6890. Si necesita alguna adaptación especial para asistir o participar en la reunión. Más información sobre las becas en bloque para el desarrollo comunitario de Oregon, el proyecto propuesto y los registros sobre el uso pasado de los fondos de la beca en bloque para el desarrollo comunitario del condado Benton están disponibles para revisión pública en el 205 calle 5 noroeste, Corvallis, Oregon 97330 durante el horario de oficina. Se solicita notificación previa. Si se necesitan adaptaciones especiales, notifica a Teresa Farley al 541-766-6890 para que se pueda proporcionar la asistencia adecuada. No se prevé el desalojo involuntario permanente de personas o empresas como resultado del proyecto propuesto. Si el desalojo se vuelve necesario, Se examinarán alternativas para minimizarlo y proporcionar los beneficios referidos, razonables a los desalojados. Cualquier vivienda de ingresos bajos y moderados que sea demolido o convertida para otro uso será reemplazada.
Thank you, John, Mary. Much appreciated. Are there any comments from the public?
Commissioner, I would just add to this that I want to thank Benton County for your leadership in applying for these funds. Very few of these funds have gone out in Oregon because, as we know, CDBG grants can be notoriously somewhat challenging to move through. But I know from talking with Brian over at Lynn Benton Food Share how far these funds will go towards supporting members of our community. So thank you.
Thank you for that. Much appreciated. Your help. I know it's a cumbersome process. Okay. If there's no public comment, I will close the public hearing, and I'm ready for a motion.
I'll move to approve the application for a community development block grant in the amount of $250,000 to be used to support the programs of the Lynn Benton Food Share.
Second. All right. All in favor, please signify with an aye.
Aye.
Aye. Thank you very much. I'm very excited about this big infusion of funds for Lynn Benton Food Share. Help them with their infrastructure needs. Okay, moving onward. We are now finished with our public hearings and moving into departmental reports and requests with a discussion and decision to accept a segment of Northwest Stone Ridge Avenue into the county road system, public road P04442. Gordon.
Greetings. Gordon Kurtz, Benton County Public Works. I'm an associate engineer. We are recommending to the board that you accept a segment of Stone Ridge Avenue into the county road system. Stone Ridge was built several years ago, and the majority of that road was accepted into the county system about 3 years ago. And the segment, the subject segment today is an extension of that road beyond the cul-de-sac, and it is a portion of the road that was built within a reservation for future right-of-way dedication. The right-of-way was dedicated, the road was built, we kept track of it, went through its warranty period. We are just simply here to request that you accept this segment into the road to make it a contiguous county road. That's about the long and short of it.
No plan. Are there any questions for Gordon? Okay, and so the warranty period is passed, no problems, we are ready to roll. I would be happy to entertain the motion.
I'll move to approve order number 2021-062, accepting the described portion of public road within the Stone Ridge Estate subdivision. Northwest Stone Ridge Avenue, public road number P04442 into the county road system.
Second.
Okay, all in favor, please signify with an aye.
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 Aye. Thank you very much.
Thank you.
Short, sweet, at our end. Next up, we we have a matter, second reading, amending Benton County Code Chapter 2 Contracts, Ordinance number 2021-0303. Vance is not here with us today to present that, but the matter is relatively routine at this point. So,
Commissioner, I'm happy to jump in if the board has any questions.
are there any questions? Okay, hearing none, I will accept a motion.
I'll move to enact ordinance number 2021-0303, amending Benton County Code Chapter 2, and conduct a second reading of the ordinance.
Second.
Favor, please signify with aye.
Aye.
Before the Board of County Commissioners for the State of Oregon, County of Benton, in the matter of amending Chapter 2 of the Benton County Code to update purchasing rules, ordinance number 2021-0303. Short title, the ordinance shall be known as Amendment to Benton County Code Chapter 2 to update purchasing rules. Okay. New business. In the matter of naming the 4500 Research Lane building. Johan, welcome, and Lydia, if you are here, welcome as well.
Good morning, Commissioners, staff, and members of the public. My name is Johan. I'm the CDA Pronouns, and I'm the Equity, Diversity, and Inclusion Coordinator for Benton County. I'm excited to re-present information about the naming of our building. Last week I presented the goal-setting meeting, and I know that public doesn't attend that as much, but I wanted to provide that. So if I get screen sharing access, I can give a brief overview of the presentation last week. I don't know if Lydia will be joining us. Just double booked. Still have the screen sharing.
Either Joe or Teresa that will have to do it.
Perfect. Excellent, thank you. All right, this is the same presentation as last week, so we can have time to get it organized. So what essentially is a quick review is I was tasked with helping find the name, honor the name that was for our building. We had many employees submit different suggestions for it, and I just ran with those to honor our focus on naming it with a focus on equity, diversity, and inclusion, and really the impact in our community. So a lot of suggestions went back to the indigenous communities and people in our area. And after going through that and seeing other things and removing some of the recommendations based off of feedback from David Harrelson from the Confederate Tribes of Grand Ronde, we came up with a recommendation of the Untitled building. We heard feedback last week about the sub-name of it, or building versus place or some other name, but right now my still suggestion is building, unless you all have another idea. But cemetery doesn't seem to really fit the purpose of that building, and I think most people will just call it Hallelujah anyway, so I'd rather we focus on that name. But if we do find another surname for the building, that is welcome in my eyes as well. So just a quick history again of why we chose this name. Was the California people consisted of 13 different tribes that were original caretakers of this land since time immemorial. Colonization resulted in California people having their land reduced with other tribes into what was now Confederate Tribes of Select and Confederate Tribes of Grand Ronde. Alsea was also impacted by this. Then we have the city of Alsea to honor that. And as settlers, it's our responsibility to acknowledge the horrible genocide our ancestors committed and the privilege we have. in naming this building. We also are honoring that this area wouldn't have existed in the way it is with the fertile land that we have and the great environment without the practices of the health of the people, such as controlled burns that they did, to make sure that we had the environment that we do now. And all the different things we're doing to honor the lanes is wonderful, and we want to keep doing that moving forward. So if we're figuring things out with dulcet and everything, sometimes it's naming ceremony, ribbon cutting ceremony, we should be inviting people there to celebrate and continuing to collaborate them with all of our county teams so that we can honor them and look forward to our work in the future. But I think this is an excellent step towards honoring that. And we will talk further about additional names for some other rooms in the building. But examples included the Homespoken room and the Harriet Forrest Moore room, which we had previously discussed. And I can get more information if that is desired. And Leah is now here if she has anything else to share.
Leah, do you have any comments at this time? Okay, are there any comments or questions from commissioners?
Yeah, I appreciate the thoughtful process, and it's a good way to acknowledge our history, and I think that's important, and I like some of the suggestions for naming rooms within the building to honor some people that need recognition, and it's to our benefit to know some of the people that have come before us and just get to where we are today. So I think this was it took a while, but I think it's worthwhile, and I think we've come up with a great name, and looking forward to being able to celebrate the name and the building sometime in the near future, or future, maybe I'll just say future. So appreciate the effort.
Thank you.
Thank you. I'm grateful for the collaboration with David Harrelson of the Confederated Tribes of Grand Ronde, both to continue to deepen those ties and partnerships. Any other discussion?
I just want to say thank you to Johan and Lilia for all their work on this. I really appreciate it.
Thank you, and I also really want to emphasize this is feedback from our staff prior to my position even existing. So a lot of suggestions are coming from them, including some of the sub-name suggestions. So I want to make sure that we're honoring the staff as well. And thank you for this.
Thank you for making that point. This is a great list of names. Okay, I would be happy to entertain a motion.
I'll move to name 4500 Southwest Research Way, the California building.
Second.
All in favor, please signify with an aye.
Aye.
Aye. Thank you very much.
Thank you all.
Okay. Now, moving on to item 8.2, in the matter of approving order number D2021-062. Actually, I think that's 063. We already had an 062 today. Requiring face masks in indoor and outdoor public settings. April, Suzanne, welcome.
Thanks, April. I'm going to turn this over to you.
Thank you so much. Good afternoon now, commissioners and all. This morning we engaged in a a lengthy, sobering discussion around the state of COVID-19 and the Delta variant in Benton County. After reviewing some data, after hearing from Laura Henham, the CEO of Good Samaritan Regional Medical Center, we brought to you a recommendation to have the board issue an order not only to mirror the state's indoor masking order, but to go beyond by requiring masking in public outdoor spaces when distancing cannot be reasonably maintained. There are a few things that I think that, you know, in this session we need to figure out. The one is the threshold at which outdoor events, you know, must mask. And I can go into more detail with the data that I shared with you this morning. And then, you know, pertaining specifically to the order, maybe I'd like to explore with everyone what sort of a guidance document that may accompany the order to illustrate things like exceptions to mirror the OHA rule, and of course anything else that you'd like to cover. I can bring my presentation back up so to help guide us if you don't mind making me presenter.
Just one moment. Joseph at the controls, we will complete this there shortly.
Thank you. Okay, I just went ahead and stopped at the outdoor settings slide. We did kind of pause in our discussion earlier in discussing the need to have the board determine this number. What we did, just to reiterate, because we have more and different people on the call, our epidemiologist estimated the number of new infections 4 weeks after a gathering of unmasked people with different percentage of vaccinations within the group. They took into account many things, a big risk reduction for being in an outdoor setting, the average number of contacts, which is based on disease modeling, and an assumed 80% effectiveness of vaccination. And the numbers that came out ranged from 59 new infections for a gathering of 25 with 100% vaccination to over 2,700 infections for a gathering of 300 people with 30% vaccination. Before we go into this, just want to reiterate, Delta variant is a new beast that we're dealing with, and we need to take different action. There are things that we know work, and masking is certainly one of them. And finally, I want to just restate that if we do want to include a threshold for the number of people at events when a mask would be required versus recommended, this would be based on the board's risk tolerance. In other words, how many cases would you be willing to risk given the different sizes of gatherings that wouldn't require masks? It's also important to consider the likelihood of compliance with the smaller group sizes with an order that relies upon people to adhere, since there's no enforcement component in a Board of Commissioner order. Okay, that's all I have for now.
Thank you, April. Are there questions for April at this point?
I'm not sure if you can answer this, April, but I'm trying to think of an event where there was 100 people and nothing pops into my mind, I guess. Do you have examples of what kind of events for the 100, the 200, 300 kind of limits?
Sure, just off the top of my head. In terms of outdoor gatherings, you may see smaller concerts outside. You may see outdoor church events. I don't know how often these things would be happening in outdoor settings. I think that it's reasonable to say that many large outdoor gatherings may be larger than 100. Something that comes to mind also is our weddings, right in that range. But anybody else have any examples at the ready?
Could be fundraising events that are a combination of both indoor and outdoor.
I don't know, the fall festival still happening?
Sure. Yeah, and then, you know, the 6-foot distancing and reasonable maintenance of that is you know, we don't, it would be ideal to have this be as straightforward as possible. If an organizer of an event maintains that 6-foot distancing is occurring outside of things that are exceptions, such as eating and drinking, swimming, playing in a band, etc., as we see in the OHA rule, then, you know, they may choose to require masks, or if they say that distancing is adequate, then masks wouldn't be required.
I have a question. So we see the numbers here. I'm assuming those are numbers with no masks. Do we have any sort of idea, projections on what impact mask wearing would have?
Yes, well, we have a general reduction of transmission of about 70 to 75% with universal mask wearing.
Okay, thank you. That's very helpful to know.
I note that Steve Clark is also on the call. I'd like to offer him an opportunity to speak.
Thank you, Commissioners, and the consideration of the county continuing to invest in personal and public health measures as you have. The university is in support of face covering policies, as you know, indoors and as it regards in indoor public spaces. And as it regards this ordinance as it pertains to outdoor public settings and gatherings where 300 or more people are gather, I believe we're also in support of that as well, but we encourage very strongly that the county apply the OHA standards for indoor public gatherings to allow for individuals who, for example, might be at a sporting event and engaging in eating food or taking liquid refreshments, or for athletes participating in practice or competition at any level of sports activity, including not only intercollegiate sports, but recreational or intramural sports, and that individuals participating in performances, whether they be indoors or outdoors, whether they're musical or theatric or speaking, have the opportunity to not wear face coverings, but observe the importance of wearing face coverings where possible, and while not performing, for example, in a theatric activity, a musical activity, or speaking event. With the county, we agree that personal and public health measures are most essential in reducing the risk and spread of COVID-19 at this time, and we support the county's efforts to engage in such important leadership.
Thank you very much.
Thank you, Steve. So is there any further discussion about the threshold that we are looking at? And I see that April actually put up the exceptions as well. Why don't you address that first?
Sure. Thank you, Steve, for bringing that up. We absolutely intend on having a guidance document to accompany the order that includes all of the exceptions to the OHA rule, which includes many of the things you mentioned, as well as some that may be obvious, such as while sweeping or swimming, or if someone needs to confirm their identity. The orders themselves and the resolutions, as I understand them, are intended to be quite brief. And Commissioner Oshiro, can you elaborate on the reasoning behind that, since Vance isn't with us today?
I'm sorry, I was briefly distracted. Can you repeat that, please?
Sure. After explaining that we would have a guidance document that outlined the exceptions to mirror the OHA rule, I observed that oftentimes the Board of Commissioner resolutions and orders are quite brief in the verbiage and the wording of them, and I thought that Vance may have reasoning for that, but maybe you would be able to speak to the reason for keeping them so nice and concise.
Unfortunately, I don't have that rationale. Perhaps Jill has a little bit more insight into that, because I was not, or Suzanne, I saw the draft of this as emerged, but I don't know the specific reason.
April, I would just interject real quick that I believe Vance really supports the concept of simplicity and clarity, and so I would leave it to that in Vance's absence.
That was my understanding as well, and he felt, from what I could interpret, quite strongly about that, but we realized that having the guidance document available is important, and certainly it may be a part of OHA or governor's order. Even though it is not being proposed that we make it part of ours, we could make it explicitly clear that this is the guidance that applies, and we don't intend to be stricter than that.
Thank you for that clarification. And I see that you also have included this table indicating sizes of gatherings in proportion vaccinated and what the epidemiological models show, based on the assumptions you described.
Yes, Commissioner. Each of the gathering sizes listed here is, we looked at 25, 50, 100, 200, and 300. Looking at the next column is the proportion of vaccinated, just sort of going with low, middle of the road and perfect 30%, 70%, 100%, and then looked at the expected number of contacts, and then moving out to the after 4-week period of continued transmission. So you can see here, I gave a few examples. A gathering of 100 at 70% vaccinated would be expected to result in over 500 new infections. And again, that those are infections, not necessarily reported cases.
Thank you. Commissioners, is there a discussion about, or thoughts about changing that threshold downward from 300 as is currently in the draft order? Yes.
I would be amenable to that. So I'm looking at the numbers. I see, a big difference between 50 and 100 and 300, but those are without the math. So if we do the math to add, to lower that number by 70 to 75%, that would be, sorry, I'm just sort of
It's okay. It's complicated, and I don't think honestly it would be as simple as applying a fraction to that total number. I think looking at I think we're looking at a little bit of apples and oranges here with universal masking. I believe that estimate is based on universal indoor masking. It would not be applicable to the outdoor situation. So we would need additional estimation to look at what masking would do. But if we do, we could look at different ways to estimate risk reduction, with including proportion of the crowd, masked, etc. At the end of that exercise, what we will see is a drastic reduction in transmission. I understand that it's difficult to make a decision based on accepted risk. I think really as the board members, perhaps that piece about ease of messaging and compliance would come in as a factor here. Again, it's not an easy decision to make, but again, there are many factors at play here.
Thank you for clarifying that, and I'll just say I still will put a plug in for changing that number down to 50. I'd rather be more safe than more sorry later on.
Yeah, I think I'm comfortable at the 300 level. To me, reading the chart, it's we'll get vaccinated and wear a mask most of the time, and fiddling around with the numbers, I don't think that's going to have a major impact in actual rates. We've got to get our vaccination rates up, and I have no clue how to do that from our current levels. But I think 300 is a reasonable level. There's no or reasonable number. There's no magic. Maybe we can go back to staying home, but I hope that that's not, and maybe that's part of the message, is if we don't get our numbers under control, that there may be more drastic things that we have to do. I mean, we have to, just from the discussion this morning, we have to protect our hospital system. I mean, that's under tremendous pressure, and it's unnecessary. We had a chance to get our vaccination rates where we wouldn't be talking like this, but we didn't get that done. So I guess I'm not convinced reducing the number on this discussion will be a game changer. So 300 is okay with me.
And can I just add in there, like Pat, I completely, understand where you're coming from, and if that's your, final decision, then I completely respect that. Like you mentioned, we are trying to keep the hospital numbers from going up. We're trying to protect our hospitals. We're trying to protect the public. If we say you don't have to mask until there's 300 of you, and we have those 100-person gatherings with no masks, the projected numbers are 522 cases. Some of those are going to end up in the hospital. You know, I feel like we talked about this earlier, the general public, many members of the general public are not taking this seriously, and I think that's because they just don't know, and they, you know, their leadership has not been doing much about it. You know, people wait for us, they wait for the government, they wait for, you know, the experts in healthcare to say something and to make a rule, and once that rule is made, I think people realize that they need to take it seriously. So I think if we are trying, this is just where I'm coming from, if we want people to take it seriously, and if we want to really protect our hospitals, you know, I feel like we should be more conservative and try to do everything we can. But again, that's just me, and I'm one commissioner.
Well, I can weigh in, and I would be one to split the difference. So I'm comfortable with the lower threshold, and what's resonating with me right now is right around 150. And that's smaller, I mean, that's more than most weddings these days, and probably more than all of the largest church services. But it is a lower number than 300. So how about that?
That's fine with me. I think the message should be wear a mask most of the time, and whether it's no matter what side, if you're in with 10 people, and I think that should be the message that we're sending out, and this is maybe a little bit helpful, but I can't see this number, no matter what it is, being a real game changer. So 150 is just a wonderful number.
Yeah, and I agree the message should be that we should tell people to wear a mask as much as possible. But the way I interpret this is, you know, still, if we're saying you can be out with 149 people or 148 people and you don't need to wear a mask, that's a different message. We're not saying wear a message as much as you can. We're saying you're fine to wear a mask. You're fine to not wear your mask outside.
Those are all great points, and just coming back to this discussion when we first started talking about outdoor crowded public spaces as in addition to a masking requirement, the point was brought up that we do not have to have a minimum size associated with that. There are other communities that have in outdoor spaces where distancing cannot be maintained. It's the enforcement compliance piece that can be difficult. Again, you know, as I said before, a masking requirement, it's all about the will of the people and giving them a rule to follow, and most people want to do the right thing. So if, you know, in determining, I can't remember exactly where the threshold conversation even got started, just to kind of give people a place to where it was needed. It was a mandate, right? And under that threshold, the messaging would be as you see on the screen. Everyone should really do these things, but when there's this many, you absolutely have to. If the commissioners would rather, you know, have a mandate that says that's very much more general, that's okay too.
I'm fine with sticking with a number. I do think that numbers, they catch people's attention. They're a hook. So that's my sense. Johan, I saw that you had your microphone on mute. If you'd like to speak.
Yes, please. Thank you. From really the equity standpoint, I think it is really important to either have a lower number or just outdoor, if you can't maintain distancing, you to have a mask. Our immunocompromised population is really in danger, and a lot of people have gone back into staying at their homes because now just being outside and in the park where we currently have nice weather, they're just not feeling comfortable to do so because people are without masks and we don't know who's vaccinated, who's not, and we still have the population of children who cannot be vaccinated yet who are a higher risk. So I think you really need to think of the most vulnerable people here and how can we support them, and having that mask expectation makes it so everyone is caring for each other and just makes it easier space for people to be having that. And I think that's really important for you all to think about.
Commissioners, I would just thank you to Johan. Something I would say that might be correlated with that is the hospital capacity, since it is those more vulnerable individuals that are also more likely to be hospitalized, whether vaccinated or not, if they acquire the infection. So it may be a place where equity and hospital capacity line up in terms of our interest.
The alternative is to drop the number altogether and just state that masks or face coverings shall be worn by persons below the age of 5 and outdoor public settings where physical distancing of 6 feet is not legal.
That's right. I do have a county order that sounds almost exactly like that from a different state. So that sounds like it would be the alternative.
I actually like that. That would be my preferred option.
Yeah, that sounds fine, and I assume if we get more information, we can modify this at a later date.
Yes, so that actually brings up a good point about the fact that we don't have an end date in this. Our intent is to come back and look at this regularly. We want to make sure that we are doing the best we can to maintain the hospital capacity and prevent disease, which would hurt our schools, businesses, and individuals across the community. I saw that there was a note from Steve Clark in the chat about making sure that we have really good guidance for our folks in the community that hold community events. And I see that there are a couple of mics that are on. The other thing I wanted to point out, though, about end date is that this, our authority to put forth this order is based on our emergency order, and that expires at the end of September. So we will be coming back in September with reconsideration to extend that emergency order. With Delta, we are going to want to have a mask recommendation and requirements in place longer than just in September this time. So let's see. I know, Pat, you had your mic on, and Joe, you did as well. Pat, Joe? Anyone else?
Commissioner, I just wanted to reaffirm what you were saying regarding this being tied to our emergency declaration. So staff will be coming back to the board in the month of September to talk to you about that emergency declaration extension. And at that time, we would talk to you about this as well. I would encourage the board to still take action today, although the order that's in your packet does have a number. We could have April restate her the language that she shared a few minutes ago and ask the board to still adopt an order with that language. I would hate to continue to postpone this dialogue to a further board meeting, so I would ask that you do take action today.
Agreed. Nancy and then Steve.
Two things. I mean, I was just going to say, I'm preaching to the choir here. I hate masks. I'm not, pulling for this because I love masks. They're terrible. I sweat a bunch. I have eczema. My lips get chapped, and I look like I have a lip disease. Okay. I hate masks, but I feel like they're what we can do, you know, and those little sacrifices that I can make for the health of my community, I'm willing to make. So that was also going to be my next question, was just going to be about the process, which Joe touched on a little bit, about, sounds like we can just accept this or move this but then amend it. No?
What we would propose is that we just modify it as we did with the floodplain language earlier, and it would be further resolved that masks or face coverings shall be worn by persons over the age of 5 in outdoor public settings with a number of persons. No, in outdoor public settings where physical distancing 6 feet is not feasible. Just
okay, so are we also going to insert the list of exceptions? It was like 4A through, no? Okay.
No.
Because right now the way it reads is just if you're inside, to wear masks or face covering at all times in indoor public settings.
Correct. And that there's been a hearty discussion internally about that, and the recommendation was to keep it really simple and fair here, and that all of the public education materials that go out and the guidance documents that go out will include those exceptions taken from the OHA language.
It seems confusing. If I was a member of the public and a restaurant owner, that might, you know, worry me. And to say, hey, I can have people sit in here, take off their mask and eat, right? But that doesn't, when I read this, I don't interpret it that way.
Okay, I will take comments from staff. Suzanne, yeah.
And I think another option, I'm most interested in how Lilia thinks this could best be pieced together in a way that makes sense, but I agree that at least referencing that there are exceptions, that there is a guidance document was important for clarity, and how to do that and where to do that, I'm going to defer to.
Yes, thanks, Suzanne. Yeah, I just wanted to jump in and say that April and I had a chance to meet between this morning's presentation and this conversation just now. And so we've discussed the need for a guidance document to be able to address all of those points, Commissioner Wine, and that's something that I am actively working on. So we hope to, and by we, I mean the public information folks, hope to have that guidance document at least drafted today, so that when we do release our press release, obviously this is a public meeting, but when we do release this information publicly, that there is an initial guidance document point, and then of course we will work to prepare talking points for the call center, which I'm sure business owners and members of our community are familiar with that number at this point, but certainly happy and willing to take any additional feedback you may have.
So Lilia, is that, or maybe a question for all city staff, is that what you would prefer? That's a better route than trying to make an amendment to just say including the exceptions as listed out, you know, for A through E or whatever they were?
It would be my recommendation to keep the order language more simplistic and have the guidance documents dive into the deep minutia. And that way, as we progress and we see more, for example, frequently asked questions, we can update our guidance document without having to.
I was just wondering, in response to Commissioner Wise's concern, Lilia, would it be possible or advisable to add one sentence to the order that simply indicates that county guidance for exceptions is available, so that somebody doesn't just take the order at face value and not recognize that there are those exceptions?
Yes, certainly, and I will absolutely work with April on that language.
I think that's the way to go. I do think that the order itself should refer to the fact that there are exceptions that are contained in parallel guidance. Steve, you've been waiting patiently.
Roger, I think, and Commissioners, as important as it is to adopt this ordinance today is to compel your staff, along with collaborators within the university, the city of Corvallis, other jurisdictions in the county, Sorenton Health, Chambers of Commerce, to collaboratively engage in an education campaign that will foster knowledge and provide guidance to event organizers, big and small, as to how they can both communicate to those in attendance, but actually manage, if you will, compliance. What we don't want is settings where people feel that either the event organizer or those in that will be cited. We want a community of responsibility versus a fear of being cited for failure to comply. At the end of the day, our ability to comply will be both personal and public. But I really think that requires leadership by the county to call upon organizations throughout the county to engage in this effort of application and understanding.
Agreed. So I would be happy, given this discussion, to entertain a motion, including specification of amendments to the document as presented.
I'll move to adopt order number 2021-063, requiring the use of masks or face coverings in indoor and outdoor public settings with two changes. We're going to drop the specific numbers for outdoor events and add a reference to our guidance document.
Second.
Any further discussion? All in favor, please signify with an aye.
Aye.
Aye. Okay, thank you. Thank you all for a good discussion on a tough topic. Okay, with that, if there's no further public business, thank you, Steve, for coming and participating. We will recess from our public session and go into executive session under ORS 192.260D. And I would like to call for just a 5-minute break before we do that, to stretch our legs and make sure we can clear the room. Thank you. So we'll be back at 12:50.